Welcome to Ask the Doctor. I'm Dr. David DeRose, taking your questions again on today's edition of the program. We're going to a question from Canada. Danny asks from Winnipeg this very relevant and practical question. Is juicing fruits and vegetables an effective way to get my 5 servings of fruits and vegetables per day? Well, first of all, Danny, let me commend you. You've gotten that message that public health professionals have been trying to get out for many years, and that is we need to be getting a minimum of 5 servings of fruits and vegetables a day. Many are pushing that number up to 9 or more, but your perplexity is exactly where many people are at, and they're simply saying, how can I get all this in? Should I just start juicing? I know it's become very popular, but let me tell you, many of the patients that I see in my clinic, their problem is not so much what they're eating as how much they're eating in total calories. When it comes to juices, there's an intrinsic problem. If we're eating our plant foods or any food as a whole food, as we're chewing that food, we're getting a lot more satiety, a lot more satisfaction from the food than if we reduce it to, let's say, a pureed state or even a juice state. Let me give you some insight into this. Classic study was done many years ago. They took apples, had volunteers in this study eat the same number of calories as whole apples, then compared it to apple sauce or apple puree, and then compared that to apple juice. What they found is those who ate the whole apples, for a given number of calories, those whole apples gave them much more satisfaction and held them much longer before they wanted to eat again as compared to the apple sauce. What do you think fared the worst? Yes, the apple juice. Bottom line, the more juices you eat, you'll tend to take in more calories, which will often make it more difficult for you to trim down if you're carrying some extra pounds. Said another way, if you're an athlete, you're doing a lot of exercise, you're on a vigorous training program, juice actually could be added to your program. Sometimes I have people take it a half an hour before their meal so it doesn't interfere with their appetite too much and doesn't really give them the effect of an added meal, but kind of extends the benefits of a given meal, can get some more calories in that way. So sometimes I will, in unusual circumstances, I say unusual because most of my patients are not athletes. They're people that are trying to trim down, and so the message is to cut back on the juices rather than increasing it. Let me tell you another concern I have that I don't hear many people speaking about. It's probably on the tip of some of your tongues. It actually has to do with your tongue and your mouth. It's something called urogastrone. I know I took the words right out of your mouth, didn't I? Urogastrone is actually a compound that is made in the mouth when you chew your food. It's important for optimal gastrointestinal health. If you want a healthy stomach lining, by the way, we've got an epidemic in our country of gastrointestinal problems. Something that can help is making more urogastrone. How do you make more of it? You simply chew your food thoroughly. Isn't it amazing? So again, juices bypass that natural protective mechanism. Juices also can have some deleterious effects on your blood sugar. What's the bottom line? For the average person, I say eat your fruits and vegetables, definitely, but eat them as whole foods. That's what I do on a regular basis. That's what I recommend my patients do. If you've got an unusual situation where you're trying to increase your calories or you're on some kind of a special fast or something and a doctor's supervision, there may be a place there, of course, for juices, but in general, not the best thing in my experience or in the research literature's experience to include in your program. I'm Dr. David DeRose. The show is called Ask the Doctor. You can be included, at least your questions can, simply by sending them to ask@lifeandhealth.org.